Good evening, everyone, and welcome to Sister Sip. I am Lilli Jackson with Fair Count, a nonpartisan nonprofit focused on increasing civic and voter participation across the South. And we hope that you and your family are safe and healthy during this time. We'd like to thank you for joining us this evening for Sister Sip, hosted by Sisters for Civics, Fair Count Civic Engagement Initiative to ensure that Black, Latinx, Indigenous, and all women of color are seen and heard. Tonight, we're hosting a real talk conversation with women across the South. We will discuss the mental health and well being of our children with our special guest, board certified pediatric primary care physician, Dr. Rasheeda Monroe. She is also the director of the Keenan Urban Scholars Program at the University of North Carolina School of Medicine and a member of a phenomenal group of doctors called the Sister Circle of Wake County. Dr. Monroe? There we are. Dr. Monroe, how are you this evening? It is a privilege to have you join us tonight.
I'm so great, Lilli. It's great to see you, and I'm happy to be here.
Yes, thank you so much. This is a sister sip. So everyone raise your glass so we can make a toast. All right. We promise to provide a safe space to unwind while addressing the real issues that affect us. If you RSVP'd, you receive the recipe for a sister sip strawberry lemonade, or just grab your favorite end of the day cocktail because you deserve it. So here is to us and the spirit of sisterhood, to creating spaces for ourselves in the world that nurture us, understand us, and let us unwind in comfort. Here's to taking care of ourselves because self-care is taking care of our community. And to close with my mother's favorite quote, here is to good women. May we be them, may we know them, may we raise them. Cheers. All right. So, our friends at Healthy Democracy, Healthy People recently reminded us that democracy makes our communities more inclusive and healthier. Our votes affect health policy, clean air, housing, transit, and funding for hospitals. When we're healthier, we're more likely to vote, and communities that vote experience better health. That quote from our friends emphasizes the importance of your vote as your voice in democracy. So let's all make a plan to vote today. We have three easy options in Georgia. You can vote by mail with an absentee ballot, and that application request period opens on August 22nd. Another option is to vote early in person in your county starting October 17th through November 4th. And the third option is to vote on election day, which is Tuesday, November 8th. Write it down, Tuesday, November 8th. You can visit your My Voter page at mvp.sos.ga.gov. It's going across the screen right now. So you can go to that website, you can find your voting locations, and you can make a plan to vote. I also want to invite you to visit sistersforcivics.org and sign up to become a member and stay in the loop with what we got going on with Sisters for Civics and about the sister sips to come. While you're on the site, go ahead and commit to vote by completing a CTV card today, because an informed voter is a protected voter. You can scan that QR code at the top of this screen to make your commitment to be heard in November, and it will direct you to the website. And lastly, I just want to remind everyone that Fair Count is a nonpartisan, nonprofit organization, and as such, we do not advocate for the defeat, the election, or the re-election of any person from any political party. This is an interactive conversation, so please be sure to leave your questions in the comment section for Dr. Monroe to address. All right, so again, Dr. Monroe, thank you so much for joining us this evening. I feel that this hour will go by so quickly, so let's just jump right into tonight's conversations. You and other physicians formed the Sister Circle of Wake County. Could you please tell us a bit about the Sister Circle and why you felt it was important to form the bond and some of your initiatives?
Thank you for asking that. The Sister Circle, we're a team of 6 African American women physicians who actually came to know each other in a pretty, I think, organic way. It's actually our Sister Circle member, Dr. Michelle Benoit Wilson, who's a kind of connector of people who kind of all, brought us together. But the purpose of us coming together was really as a support group for each other. As Black women in medicine, we are unicorns. We're only 2 to 3% of the physician workforce. And it can be challenging to navigate, our careers and the places we work without the support of people who understand us, who look like us, who've experienced some of the same things. And so that's actually how we came together, as this kind of organic group of women, just like caring on and loving on and supporting women. And then the pandemic hit. And so during the course of the pandemic, we're all working in our prospective areas in medicine, and seeing how COVID was impacting our family and others and our community and the patients we care for, and just all had this deep passion to want to do something about what we were seeing. So we started with the vaccine efforts in early 2021, when we saw that Black and Brown communities were being most heavily impacted by COVID, with highest rates of hospitalizations and deaths, yet when vaccines were rolled out, had lowest access to those vaccines. And we wanted to do something about that. So we worked with many amazing people in our community here in Southeast Raleigh and Wake County, community leaders and the health department, and our faith leaders were unbelievably important in the effort, and a huge group of volunteer physicians from all around the state, honestly, nurses, school teachers, everyone pitched in. It was like an all hands on deck type of effort. And for months and months, we vaccinated people every weekend, and end up vaccinating almost 15,000 doses in arms, and help close the disparity gap in the Black and Brown communities in this area as it pertains to COVID-19 vaccines. So that's how we started, I think, doing probably our advocacy work. And since then, we've been involved in several different efforts. But that's the story of the Sister Circle.
That's amazing. I truly have been blown away by each of you. I'm honored to have been able to have these conversations with you all and plan these events with all of your specialties. I know I feel a little safer knowing that there are doctors like y'all out here that we can find, and who truly care, not only for their individual patients, but the entire community that surrounds them. So thank you so much for all that you do, and for being here with us tonight to share your expertise.
I'm so happy to be here. So thank you.
Awesome. As a pediatrician, we're really going to lock in on questions on children and their health and well-being. So, the kids are returning to school, and let's be real, the pandemic may have worsened children's mental health, or exacerbated the existing mental health issues among children. This could make the transition back to school more challenging for families. So do you have any suggestions for our sisters and the brothers who are on the line to help with the transition back to school?
I always think communication is probably the key to most things being successful, is making sure that we're talking to our children about what to expect, about what may be different or challenging this year, kind of setting expectations. And just having that open dialogue, asking them about their fears or their worries, and even what they're most excited about and looking forward to. I've had this conversation recently with my boys, and of course, for them, it continues to be, we're excited about sports and sports and sports, but, having something to look forward to, and, friend connections to reengage with, after the summer. Those are the things that, children often will look forward to. But, there's going to be children out there that are having a lot of anxieties and fears about certain things, whether it's, COVID, or, maybe a learning environment that didn't feel safe to them because of, bullying or different things like that, the pressures of school. So just having those conversations and kind of getting them prepared, for us in North Carolina, I know in Georgia, you guys, I think, already went back to school. You start
Yeah.
back well before us, but
Yes.
it's time to start getting people back to their normal sleep schedules if they've been kind of sleeping in late and going to bed late in the summer, and kind of getting them prepared for the routine of school again.
Yeah. Excuse me. Those are all really great examples. And I do not have children yet, but my nephews are the closest thing that I'll get. And one going into high school, just getting ready for that transition after, being in and out of middle school. So you really haven't had those social experiences to teach you these lessons. So I can only imagine the anxiety after this pandemic. And speaking of the pandemic, what would you say to parents who are one, hesitant to send their children back to school for fear of the virus, or hesitant to vaccinate their children against this virus? What should parents consider during this time?
That's an excellent question, and a question that I think a lot of families and caregivers have been asking for the past couple of years. Um, so the first part of the question, what should people, consider, who are concerned about sending them back to school? So one, I would say, give them the highest opportunity to be healthy and successful if they are to come in contact with COVID virus, right? Because we are going to come in contact with it, and so having them vaccinated and boosted if they're eligible. If they are in a very high risk group, if they are have a compromised immune system or receiving treatment for cancer or other things that would compromise their immune system, then they certainly should be someone who would consider being masked in a KN95 or a high quality mask, during school, and limiting the time that they're without the mask, like less than 15 minutes for eating. And I know that's hard because in a lot of school districts, I know here and there, there are no longer mask requirements, and most kids probably have chosen to be unmasked. And so it can be kind of concerning, especially for parents who have children who are at risk. But I would definitely say talk with your pediatrician, talk with your doctor if you have a specialist physician caring for some particular illness, and assess the risk and the pros and cons to returning. For some children, the social isolation of virtual learning that happened for a year. For some people, they chose 2 years of virtual learning. For some people, that social isolation is more concerning and worse than even their fear of COVID virus. And so they're weighing those options in a really different way. I think everyone has to consider this for the specific needs of their child and their families. For my boys, they're healthy boys for the most part. One has asthma, so we're making sure his asthma, treatment and control is optimized. So if he were to contract COVID, that his lungs are as healthy as they can be. They're both vaccinated, double vaccinated and boosted, because they're in the group 5 and above that's eligible for that. And I gave them the choice when masks were optional, and they both, no surprise,
Yeah.
chose no thanks to masking, and I was okay with that. And, I'm a physician. I'm in a workspace where I'm seeing people who have COVID or potentially have COVID every day. Of course, we are still masked and using appropriate PPE. And that's what's right for me in my situation. But for them, as healthy kids in a lower risk situation, that's what they chose. And I was okay with that. So I think everyone has to figure out what's feels safe and best for their family.
Yeah.
regarding the COVID vaccines, I would definitely encourage people to get their children vaccinated and make sure they're up to date with their vaccines, including being boosted if they're eligible. Um, the Pfizer and Moderna vaccines are available for people 6 months and older, and are safe and effective at preventing severe disease and hospitalization. The youngest children, the 6 months to less than 5 year olds who we've been vaccinating in this most recent approval, with this most recent approval, we've been vaccinating recently. They have had such minimal side effects, has been my observation. They've all done, really well with it. So, I would definitely consider getting people vaccinated before school starts if your state hasn't started yet, or before we get into the fall. We probably do expect to see another, COVID surge in the fall. So I would definitely encourage getting people protected.
Thank you so much for that. I love that you gave them an option, even as a physician, like knowing that we're 2 years in this right now, and being as safe as possible. I still maintain that distance. I still mask up in public. I just to be as safe as possible is really important. So thank you for that. We're now going to take a few questions from the audience. So remember, you can submit your questions by adding them in the comment section. We see them, and we can read them out and get those answers. Again, I'd like to remind everyone that we are a nonpartisan, nonprofit organization, and as such, we do not advocate for the defeat, the election, or the re-election of any person from any political party. All right. While we're waiting for the comments from Facebook, we did have some earlier questions submitted, so I'm going to go there. So we've spoken to parents, and we're about to dive in here. So we have spoken to parents who are concerned about school shootings. Many parents have begun to worry whether the news of school shootings, along with the active shooter drills that most schools are now conducting, are damaging our children. What are some thoughts that you would offer to parents, and how to help those children deal with that anxiety?
So first, I just want to say I am with you. My heart breaks often when we have more news of school shootings. And of course, I worry about my children every day. Every time they step out the house, and sometimes inside the house, I wonder, like, are they going to return home safely to me today? I completely understand that worry of parents and caregivers. Um, for me, I just have to have faith and trust that they are going to be well. I think if I worried about everything that could happen to my children, I would probably like never let them out the house, and I may never leave the house myself. I appreciate that our school has done a fantastic job with the, safety protocols and the automatically locking doors and the access to the school being extraordinarily limited if you're not supposed to be there. That they have trained our children on what to do with these active shooter drills, which it breaks my heart that they have to do that, but it's important that they do. And I, though, my kids are aware of it, obviously, I mean, they're going into middle school and second year in high school. I really make a point to not, when there's news of another shooting, I don't let it play on the news in the house, on the radio. If something's coming on, I turn it off. And honestly, I do that for a lot of things and always have. I really don't think kids have like it's not good for their mental health to be exposed to all the horrors and dangers of our world always, right? So like evening news has never been something that I would let my kids listen to. They're still, informed citizens. I'm just really careful in the way that like I let them have access to the anxiety provoking evening news and school shootings and that type of thing. I'll never forget when my youngest he was like in pre-K, and he saw something on the news about, a war, across the world,
Mhm.
and asked, how close is that place? Is that place close to North Carolina? Are we safe? And I thought, oh my gosh, like his little brain doesn't have the capacity to really put this into perspective, understand, and, it impacts our mental health, right? Like I know my adult friends and colleagues have decided like I need to turn off for a while,
Yep,
right? Like
yep,
not give myself access to, whatever news channel and what I read. So I've always been careful about that since that time. But I just think it's really important again to sit down and talk with your kids about their, fears, anxieties, and concerns, and do your best to give them the confidence that their school has done the right things and that they're going to be safe,
mhm.
which I know sometimes feels like how can I tell them that when you know I don't really know, but um, I don't know. I have to put it in perspective and think like, what's our alternative?
Yeah.
What am I going to, we're not in a place where we're ready to pull our kids out of school and homeschool them. They are having excellent learning experiences and social experiences and all these things, and for us it's worth it, and we let our heart leave our bodies every day when we send them to
Yeah.
school, and pray that they come home safely. But yeah.
Yeah. It is it's a tough time that we're in. And I love what you said about how we even have to take breaks and we have our, fully formed adult brains, but the amount of anxiety that even watching the news give me, because they're giving you the highlights, the attention grabbers. They it's crime, 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 to get you to watch. And sometimes you need balance. Everything needs balance.
Absolutely.
So taking in too much of that um, is a lot.
Yeah. What I would suggest is I think is really, really important is families sitting around, you know, a table together, whatever your family looks like, and having kind of daily conversations, debriefs. I mean, it can be 5 minutes in the car where everyone doesn't have their earbuds in and and the radio is not on. I
Yeah.
try to make a point that when during our transit time to whatever sport practice we're going to that week,
Yeah.
um, that we I kind of leave this kind of space for quiet that gives us the opportunity just to have some conversations,
Yeah.
right? Because you ask your kids how was school, fine, anything happened, no, right? But if you just give them kind of space and opportunity, the things that they may just kind of organically say to you or bring up in conversation really gives you the opportunity to really learn what's going on inside their little minds and
Yeah.
hearts. And so anytime that you can create that space, whether it's around the dinner table or in the car or, on the bus, during transit, whatever it is, try to do that.
That is actually the perfect transition, because during those times that you're having those conversations, what are some of the signs that we should look for to know that our children are, they're a little stressed out, they have anxiety? Because just like you
Mhm,
said, they're fine, you know,
mhm,
I'm okay.
mhm,
School,
mhm.
I learned math, like, so what are some of the signs of stress, anxiety, depression in children and teens?
Yeah, that's a great question. So, children may be irritable, they may be withdrawn, they may have poor sleep or low energy. They may not want to do the things they used to enjoy doing. All of these can be signs of, anxiety or depression. They may have low mood, poor appetite, things like that. And oftentimes, if we have open and honest conversations and our children are used to being able to come to us as a safe place to have these open and honest conversations, or maybe hopefully their pediatrician.
Mhm.
I mean, the number of times that I ask a teenager, how are you feeling? Do you feel like things are going well? Are you feeling sad? Are you feeling overwhelmed? Are there things that you're feeling overly afraid of, just asking that question and leaving space for the answer, it usually pours out of them.
Yeah.
Um, you know, either that or they can't look you in the eye to answer the question.
Hmm. Hmm.
And it doesn't pour out, but you know that that something's not right.
Hmm.
Um, and so, I really just encourage people to, take notice, be there and ask the questions and in a non-judgmental way, because that's the other thing. Children will open up if they feel it's safe to open up,
Yeah.
right? But if
Yeah.
they fear that they're going to be criticized or dismissed or not believed, not helped,
Hmm.
then they're not going to open up, right? And
Hmm.
so, and in the Black community, we do have a long history, unfortunately, of not really, uh, supporting, understanding, treating mental health concerns in our families and community members and on ourselves. And so, it's not something that will just, go away necessarily, or is just inside their head or whatever else we might say to ourselves or our children. It's really something that needs to be addressed, so they can get the help and improvement.
Yes. Completely agree. And asking those right questions, because we will give, especially, I can remember how short I was, like as a teenager. I was very quick with my answers. But if you ask the right question, the stumbling over the words was how you could tell that
Mhm.
I was really stressed out.
Mhm.
All right. We have a question from the audience. We're going to pop that up on the screen. Oh, here we go. How concerned should parents be about their kids catching monkeypox this school year?
Wow, thank you for that question. I don't feel like our brains are quite ready for the next viral outbreak, are we? Like, can we get rid of COVID,
One
or can we
at a time, one at a time.
one at a time? I
Oh,
agree. Get in line, monkeypox. It's not your turn, or just
yeah.
look away. No, I think that's a reasonable question that people are having, fears and anxieties about. Um, you know, right now, in our state, I'm in North Carolina, there has not been any transmission. There have not been any positive cases in children yet. I say yet because there's been positive cases in adults,
Mhm.
and we do anticipate that we will at some point start seeing cases of monkeypox in children. It really does take kind of close contact that's sustained, right? So skin to skin contact and kind of rubbing and friction of the skin, or to an open lesion on you,
Mhm.
right? So not just like your intact healthy skin, um, or contact with a surface that has monkeypox virus on it, um, or being in very close contact and respiratory spread. So there will be some transmission. Of course, I have no idea. It's impossible for me to predict or guess, but good hand hygiene, washing hands, and not having contact with people with either suspicious skin lesions, or people who are in high risk groups, getting access to the monkeypox vaccine to help prevent that in high risk groups. Which we hear a lot about, men who have sex with men as one of the highest risk groups, but we can't just consider that as the only risk factor. It's going to
Yeah.
cause a lot of stigma. It's going to cause
Mhm.
people to underreport and under treat, or get vaccinated. So for me, as a mom and a pediatrician, my concern for that right now is low. It's not something that's keeping me up at night.
Okay.
I know it's something that in the future, I, as a pediatrician, from a physician standpoint, will see and deal with. Um, but for now, I mean, there's nothing we're doing differently in our lives. Um, you know, one thing at a time.
One thing at a time. One thing. In these back-to-back pandemics, while we're talking about mental health and
Right.
anxiety, the news even surrounding that
Yeah.
is just, I'm never leaving my house again.
Yeah.
Like, I was just about to be back outside.
Right. Right. And it's too much, honestly. Like for me, I do have to compartmentalize a little bit. Like, okay, what are the things I need to know now, act upon now to keep me and my family safe now? I
Yeah.
try not to think of the things that are further in the future that don't impact me this very moment when I'm feeling overwhelmed,
Yeah.
right? Like obviously I think about the future and I plan, right? I'm not saying that, but if I'm feeling overwhelmed about things that I really don't have any control over, I
Mhm.
have no control over that, right? Then I'm going to put it aside and worry about the things that I have control over and that are present in front of me now.
That's a message that we should put that across the screen. Let's focus on what we have control over now.
Yeah.
Um, so that's awesome. So being back on the topic of mental health, um, how can we as parents and aunties, how can we advocate for our children's mental health?
Well, I mean, I think there's certain things that we certainly can do that we have control over that we can help support our children and help, protect their mental health. One of the things, I mean, I'll start with just a couple of maybe easier things is adequate sleep. That is underrated how important getting enough sleep is for your mental health. I mean, I want you to think about you may be in, I don't know, um, a high pressure time, whether it was in school or in your job, where for days in a row you didn't get enough sleep, and you got a couple hours of sleep for 2 nights in a row, and what you felt like, right? Like a zombie, like you were fried,
Mhm.
frazzled, irritable. Um, our kids need a lot more sleep than people realize. Generally, I think elementary school kids need about up to 12 hours of sleep, middle school kids up to 10, and high school kids up to 8. And I say up to because there's some variability there, but they need to be offered that much sleep, right? So
Okay.
when I hear elementary school kids whose parents are like, oh, they're getting plenty of sleep, 8 hours. Well, that's how much an adult needs, like a fully formed adult brain, not a growing pediatric brain. They need a lot more sleep. And before elementary school, even more than that, they'd be offered a full 12 hours of sleep plus their nap
Naps.
for,
Yeah.
for kids in that
I
toddler
think I'm still
age.
on that schedule. I think somehow I'm still stuck in that 12 hours plus some
Listen,
naps. Somehow.
well, listen, there's variability in adults. Some adults are perfect with 5 to 6 hours, and others, like me, need more than 8. So, me and you. So, one, getting enough sleep can help protect mental health. Another thing is, nourishing their body with foods and things that feel nourishing to them and or to them and to us. And I'm not saying like everyone needs to be eating like kale and
Yeah.
vegan all day or something like that. But balanced meals, offering a variety of foods, reasonably nourishing things, and then I think joyful movement is so important to promote mental health. So that doesn't, again, have to be exercise that feels burdensome or really, really hard. I specifically say joyful movement because I want you to move your body in a way that feels good to you, and encourage your kids to do that. So, I mean, that can be like, a teenager dancing in their room to their favorite song, just moving their body, or going on a walk, listen to their book, or chit chatting with their friend. Those things are really important. But one of the things that I like to emphasize is they need someone in their corner, right? So someone where they are affirmed,
Mhm.
that they matter, that has their back, that when they walk in the room, that person's face lights up when they see them. And you can remember, Lilli, I know I can remember as a child when I felt, man, this person really loves me,
Mhm,
right? When someone's face would light up when I walked in a room.
mhm.
And kids really need like that person. They need that person. They need to feel like loved and supported and important.
Yeah.
And then they need to be in a safe environment, right? They need to feel, safe and supported. So those are some of the things that I think of, like some of the basics, like movement, sleep, nutrition, but then also like a safe, supportive, affirming environment. And I say affirming, when I say that, I really also think of, kids who are differently abled, maybe, or in the LGBTQ community. They need people who affirm who they are as they are.
Especially with what you were saying earlier, if you want them to open up to you, if
Right.
you want them to tell you when they are in a stressful situation or they are really in crisis,
Right.
then they need to be able to feel safe with
Exactly.
who they are and in what they're saying to you. That is,
Well, and we know that the rates of depression and anxiety, especially during the pandemic and teenagers, has really increased.
yeah,
That's worse in Black and Brown teens, and that's worse in teens who identify as LGBTQ. And so, some of those, kids in those communities are at high risk for, suicidality and
yeah.
depression. And so they, but what a protective factor is feeling supported and seen as they are. So
Mm.
it's important.
That's beautiful. I'm going to definitely hold on to that. I want to remind everyone if you have any questions or topics that you would like Dr. Monroe to discuss, please go ahead and drop that in the comment box. Um, I am going to. We have another question. Here we are. How do we help better connect the dots between personal and public health with people we talk to and interact with?
Wow, that is a great question. Yeah, I guess it depends on what level, we're talking about. I'm so happy to be here with Fair Count because I feel like this is part of, your mission, like understanding or helping people to understand how, um, legislation, the way we vote, public health really does impact our personal health. It's true that there are certain choices that that we have, but a lot of what is available to different communities as far as the availability of green walkable spaces or um, healthy and fresh foods in the grocery stores available to them
Mhm.
have a lot to do with structures around us, right? Local, state, and federal policies and structures. And so that's not out of our hands, right? As a collective, we our awareness of that can help bring healthier options and opportunities to our kids and into our communities. um, you only have so many options if if there are barriers, right? Like if you don't have transportation or the economics or
Mhm.
whatever it is to access these things, right? You hear your pediatrician say like, you know move in a healthy, a joyful way and eat healthy foods, and you're like, we don't have a safe place to play outside because things like that. So I think it's important to kind of, these grassroots efforts and, communities kind of coming together to advocate, for different things that improves the health of children and communities, and then voting in a way that helps to
Mhm.
support that is really important.
That is exactly. It's exactly what. with the quote that I had in the beginning, our friends over there at Healthy Democracy, Healthy People, and what they truly believe is, communities that vote experience better health. And it's not just a belief, it's actually, in the data, in the numbers. And so your personal health is affected by the rest of your community. So if you care for others, if you wear your mask to not only protect yourself but to protect your neighbor, um, you have better outcomes in general. Being an informed participant in civics, and it shows based on this that it increases your health. It increases positive health. So that I think that was an amazing answer to that.
Lilli, I'll add one more thing. Just in our community, I spend some times with our medical students as a medical educator and director of the Keenan Urban Scholars Program, really learning about the different community organizations that are available, to people in low resource communities. And there are some phenomenal, organizations and people out there doing amazing work. But community organization is only as good as the people who are volunteering and helping or working, right? And so I also would think, get involved, get involved. You get involved, encourage your family and your circle to get involved. But I think that's just another really important thing, that like civic engagement and being involved in your community helps to kind of lift all boats.
Mm-hmm. It is really exactly why we started Sisters for Civics, is to shine a light on the unique um, the unique needs and the reasons that women of all colors should be more active and more engaged. Even though specifically, Black women, we come out in every election, um, but just making sure that we are not only going to vote, but filling out our census. We are paying attention when lines are redrawn. We are going to board of elections meetings and just really school board meetings, truly being a part of our community, because our voices are super important. Your experiences are unique and important and deserve to be heard. So just engaging in that way is exactly why we started Sisters for Civics. I am going to go back. First, I'm going to go ahead and highlight that. We have another question. Here we are. And you did touch on this. But when it comes to children wearing masks in school, do you feel that it should be optional? I know you said you gave your children the option
Mhm.
when it was presented from their schools, but in the place that we're in right now,
Mhm.
numbers may keep going up, they might go down. We're just day by day.
Yeah.
Um, how do you feel that they should be in schools?
I guess that's a question, and the answer to that question may change with time and severity of disease and the variant and um, how much transmission and spread there is, and whether there's a vaccine that's effective, and all those different things. But I did feel that it was a reasonable thing when our school district, and I really appreciate the leadership from our governor and our school board that has really followed the science and data, and I thought has done a great job in our area to help families make those decisions that are going to keep kids healthy. And so when the transmission rates were low and vaccines were widely available, and children whose families felt concerned could still continue to mask, and wearing a high quality mask is still an excellent option if you choose that. Not just a cloth mask, and not just a surgical mask, but like a KN95 or N95 mask. Then I did think that that was a reasonable thing. And though it caused me angst, just because, to be honest, I've been in a mask so long at work, I feel safe behind a mask. My kids were thrilled to to take off the mask, and I think I think for a lot of children, it actually was important. So
Thank you so much for that. All right. I'm going to go back through. I'm trying to go make sure I don't miss any of these questions. Again, if you have a question for Dr. Monroe, we still have time for a few of those. You can drop them in the comment section. But while we're waiting on those, usually when we have, we host telephone town halls, we do, these events, and we kind of allow at the end for our special guests to kind of just leave some like words of wisdom, your call to action almost. So if you could go ahead and just in 1 to 2 minutes, if there were something that you wanted everyone tuning in to just know about our children and their safety and health and well-being, what would it be?
wow, Lilli. I think one of the biggest things that comes to mind is something that I've kind of already touched on, but I really think it's so important that, our children are going to go through hard things, right? Some harder than others, some um, traumas that are horrible and absolutely unfair for children to have to be navigating, some, losses and hard circumstances. But one of the most important things that we can do for our children is be there to support them, to be there, to be present, to be encouraging of them, just to be their biggest advocate and cheerleader.
Yeah.
And sometimes we put these unfair like expectations on our children, or even expect that this is our opportunity to like relive something we didn't get to live, or time lost in our childhood or something like that, and that's not fair really to put on them, but to let our children be like in the full expression of who they are as humans, not trying to be, a reflection of our image of what our hopes and dreams were for them, or for ourselves that we didn't get to live out, but
Mhm.
to really support them as they are as humans, and no matter what, show up, advocate, and have their backs. I mean, really, the outcomes for children as far as mental health and trauma, that is like the most important factor, that they've got someone who's got their back like that.
Mhm.
So I think that's the thing that I would emphasize. Like, we all can be that person, and that's the thing, it doesn't even have to be a parent or a grandparent. We all can be that person for a child, right? You could be that person as a coach, as a mentor, as a teacher, as their pediatrician or family physician, um, as their auntie.
Yeah.
So, showing up for children, I mean, I just don't think there's anything more important, protecting and showing up for children, and all the forms that can look like. It's everyone's call to action.
Yeah. I'm smiling over here because the last time that I was with my little cousins, I like literally grabbed them by the face, each of them, and brought them in eye to eye. And I was like, I want you to know,
Yes.
that you are important and I love you and I care for you. There's just been so many when you're talking about, the suicide rates and the anxiety and the depression.
Mhm.
We need to make sure that they know, even though we can do our best and try to show them and be there and like, yeah, I'm always around. But sometimes you need to explicitly say,
Mhm.
if you ever need anything, I'm a call away,
Mhm.
just to actually say it,
Yeah.
uh, to say
Yeah.
that you love someone and not just, oh, they know I love them.
Yes. Yeah, that's the thing. We can't assume, and many of us were brought up in a different time, by different parents, where kids were better seen and or
I
not
heard, yeah.
heard, right? And maybe even with parents who didn't explicitly use the words "I love you" or who didn't really give us that physical touch. I'm very fortunate that I had wonderful parents who
Yeah.
did those things and let me know that it was important. Um, but if you find yourself like, this is not what I'm comfortable with, it's not what I'm used to, this is not how I was raised, like, it's okay to break the cycle. It's okay to do things differently than how they were done for you.
Mhm.
Um, and it's okay for you to, grab your grown big teenager and just love on them and hug on them and let them know like they're not too big for that, and they crave it even when they act like they're too cool for
Yeah.
it. A lot of them really, really do crave it. My son, who I now like look up to, I'm 5'9", I'm tilting my head back looking up to him, and I can't even figure out when this happened. My oldest son, when I just give him a big hug, he will just sit there and just melt into.
Yeah.
I feel the like anxiety or the whatever, the stress of the day. He'll just melt into my arms. I will just hold on to him. And I just think the act of that is just really important.
Yeah. Yeah. Because he knows mama got me.
Yeah. Yeah.
It's that's a beautiful relationship to have, and how blessed that I hope many of us were, but definitely some of us were, to have parents who showed that example.
Hmm.
But I love what you said about breaking the cycle, and it is not anything against your parents to do something differently for your children. Your parents did the best they could with what they knew at that time,
It's exactly.
and it's our responsibility to do the same at this time for our children.
Yeah.
So I do loved this conversation. This has been an amazing conversation. Thank you so, so much. I hope it's provided insight to our children's health and wellness. I want to thank you from the bottom of my heart, Dr. Monroe, for taking the time to guide us through this conversation. To our audience members, do not forget, visit sistersforcivics.org and sign up to become a member to stay in the loop with Sisters for Civics and the Sister Sips to come. We have the rest. We will be featuring the rest of the Sister Circle of Wake County. All of them have different specialties. In 2 weeks, the next one coming up is psychiatry. So we have an amazing conversation about, this week we talked about the mental health and the health and wellness of our children. In 2 weeks, we will be discussing the mental health of ourselves as adult women, the things that we should be focusing on for ourselves, and the red flags and the green flags. We shouldn't always focus on the red flags. Like, what are the good things that we can do for self-care? Things like this. Things like having a conversation and dialogue with each other with a wonderful cocktail or mocktail at the end of your day. We have to take care of ourselves. So that will be in 2 weeks. So you can visit sistersforcivics.org for more information. While you're there, go ahead and commit to vote. We have been threading it through this conversation about how important it is for you to vote, and how a healthy democracy creates a healthy community. So please make sure that you commit to vote. Fill out that CTV card. You can also scan that QR code at the top of the screen to be heard in November, and it'll direct you to the website. So to all my sisters that tuned in, thank you for joining us, and we hope that you enjoy the rest of your night. Have a good night.